Hi, beautiful people. Today I want to talk about Baby Botox. You will see it on Instagram, TikTok, all of the social media. It's been a huge trend, I feel like, in the last few years. Baby Botox, what is it? Is it really a thing? Can I get it? Who's appropriate for this? So my personal take on Baby Botox. Baby Botox tends to be what younger people call their Botox treatments. So I'm 24 and I don't have really bad wrinkles yet. I don't have static lines. So those lines we think of as etched in on the skin. I'm not even moving my face, but I have lines that are just there no matter what I do. They don't have any of that yet. They're babies. They haven't even really damaged that skin yet, which is so great, amazing, but just they're wanting to prevent that. They see the rest of us walking around with our etched in lines, our damaged skin, and they want no part of that. They want to do everything they can to stay away from that. So they will come in and they will say, I want Baby Botox. I saw it on TikTok. And a frank conversation needs to be had with any of you about Botox dose, Botox duration, Dysport, Botox, Jeuveau, Xeomin, whatever neurotoxin you're using. And that needs to be part of the conversation too, because we know as aesthetic providers that we have these different tools in our toolbox. We have these different types of neurotoxin, Botox, Dysport, Jeuveau, Xeomin. We also know from our experience and our education that maybe while they're all very similar, they're all the same main ingredient, the chemical makeup of them is slightly different. And some of them are a little bit more of a big gun approach, and some of them are a little bit more of a lighter natural feel. So that's important to discuss with anyone, but especially with younger patients. The other discussion I always have with my patients that want that Baby Botox treatment is your dose is going to equal your duration. So whether you're 24 or 64, your body is going to respond to a dose to get you that ultimate duration. So what's the aesthetic goal here? What's your goal? What do you want to look like? You don't want to look frozen most of the time. And if you do, I'm not judging you. We can do that too. But a lot of people, they still want some movement. They still want to look natural. You've heard me say it before. My husband, my kids, they still need to know when the eyebrow goes up or the eyebrows go together. I mean business. Without me saying a word. I still need to have some facial expression. So that's a discussion that needs to be had. And if I'm giving you a very, very light dose, that's okay. But you need to know that maybe you're not going to get 3.5 months of duration for that dose. And when we think of dosing in other areas, like I obviously don't take the same Tylenol ibuprofen dose that I give my 3-year-old because there's a weight difference between us. There's a metabolizing difference between the two of us. So we aren't going to get the same dose, no. And every individual, when it comes to neurotoxin, Botox, is going to get a similar but maybe a little different dose because their muscle strength is very different. But when we think of a really young person who wants a really light dose, more preventative than anything, yes, we can give you a lighter dose. I don't like to refer to it as Baby Botox. Maybe a sprinkle. Sometimes I'll say, I'm gonna give you a little sprinkle. But the conversation needs to be had and it needs to be understood that then you will not get that duration of as quite the longevity that somebody who I put, twice a dose in is going to get. And if you're okay with that, that's okay. So yes, Baby Botox is a thing. It is a thing that we can do, but make sure whoever you're talking to is really clear in what your expectation is, what your aesthetic goal is, and what your duration goal is. So if you come to me and you say, Liz, I only want 10 units in my whole forehead and I want it to last me 4 months, whether you are 24 or 6, I'm telling you no, that's not going to happen because unfortunately, I wish I was, but I'm not a magician and that's just not the way the medication works. So just be clear on this, talk to your provider about it. It's okay. I have people come to me all the time and they say, I saw it on TikTok. I saw it on the gram. My daughter knows I call Instagram the gram. She thinks it's really pretty cringy. But if you see these things, yes, we can chat about them, but it needs to be something that you chat in depth and you're very clear about what your expectation is. All right, bye guys.